Hello, this is Dr. Stephen Gradwell. Today we're going to talk about the abductor hallucis muscle of the foot and the abductor digiti minimi of the foot and how it relates to good foot health. When we come over here to the model, this is my science project today. What we have here is this is the left foot. This is my left hand, left foot. We've got the great toe and the small toe over here, and we're looking down towards the bottom of the foot. What we have here is the abductor hallucis muscle right in this area here, represented by the red and a little bit of yellow clay. And then we have the abductor digiti minimi that's on the opposite side of the foot that inserts on the small toe, but it starts on the heel as well. In the center of the foot we have the adductor, that's adductor hallucis, which inserts on the great toe, and then it's in the middle of the foot, and it's designed to draw the toe back in, where the abductor hallucis is designed to draw the toe out. The green right here represents the blood supply. Notice how particularly close attention to this. The blood supply actually comes in between the bone and this abductor hallucis muscle, and then it comes down into the bottom of the foot. Now, when we think of the bottom of the foot, the contents of that region that we usually think about are going to be the plantar fascia, which comes through this area here, and that becomes really important in conditions such as plantar fasciosis and plantar fascitis. You might have heard those terms. Now let's go ahead and take a look at how this muscle and this muscle are really designed to move. All right, now what we're going to do now is we're looking at my left foot there, and I'm going to begin to move my adductor hallucis muscle. So I'm moving it away from midline and back in. So I'm using the abductor to come out and the adductor to come back in. So abductor, adductor, back and forth. I would challenge you that most Americans cannot do this. So I would challenge you, pull your shoes off right now and see if you can do that. So I'm actually activating that abductor hallucis. Now I'm going to rest that toe down, and then I'm going to activate the intrinsic muscles of the foot and the adductor digiti minimi. You can see that guy out over here coming in and then coming back out and back in and back out. So again, here we are with the abductor hallucis coming out. The important thing about this type of motion is as you plant down, that toe comes down to grip the ground and then you push off. Without that, you can't get the proper balance that you need in your foot. So for proper foot health, you've got to be able to acquire the movement of abduction and then adduction of the great toe, and abduction and adduction of the little toes and the toes in between. We've watched how the muscle actually moves, and I challenged you to try it. I hope that you did. But here we're back over here to the muscle again. The question is why is that important? Well, I pointed out earlier here in the green is the blood supply, and it comes over the abductor hallucis. If that abductor hallucis is drawn in too much because it's not in shape, or you've worn what I call pointy-toed shoes for a long period of time, then what happens is this muscle becomes weak and taut and tight. So it's not really working very well. It's taut and tight, and it can actually cut off the blood supply to the plantar fasciitis, or more correctly, the plantar fascia. Now, that can therefore cause plantar fasciosis. Now, you notice that I've used a couple words, fasciosis and fascitis. There was a podiatric researcher by the name of Harvey Lamont, and he found in 2003, as they were looking at tissue that was removed from people that didn't respond well to conservative treatment, what they noticed was that the tissue wasn't really inflamed as what they had always said and what they had always thought and how it always had been treated. And they found that there really wasn't inflammatory cells there. The tissue was actually dying. So what was happening is the blood supply here, represented by the green, was being cut off by the abductor hallucis here in red. So what they found is that actually created death of the plantar fascia, therefore a name change from fascitis to fasciosis. What we want to do is we want to try to strengthen or bring this muscle back online and get this muscle to chill out or relax, because most of the time it's facilitated. So we're going to look at how I was able to accomplish movement of my abductor hallucis and my abductor digiti minimi. Okay, this is how I did it. I first became interested in the function of the abductor hallucis, after I read an article by a sports podiatrist by the name of Ray McClanahan. Now, what Dr. Ray found was he was quoting the literature about the foot that we just looked at, and postulated that if we could spread the toes, that we could actually bring function back to the foot. So after going to the anatomy book and going, wait, I should be able to move this muscle, but I can't, it doesn't work. It took me about 3 days to get the muscle to activate. But how I was able to bring that toe online is I started using one of Dr. Ray's correct toes, or actually 2 of them, both feet, but I put those actually fit into my shoes. And then after 30 years, or nearly 30 years of wearing orthotics, I switched to more of a minimalistic approach. I did it slowly, and I switched by starting to wear a Lems type of shoe that gave me a bigger foot imprint. And then I did exercises. I did exercises like Achilles eccentric Achilles eccentric foot exercises. I did short foot exercises, which I've made videos of those, and you can find those on our YouTube channel. And then, of course, I use the correct toes, which we sell now, and you can find those online on Amazon, a number of different places. Over the course of a very short period of time, then I was able to get the muscle to function. Of course, I did certain types of therapy. I utilized NKT, or neurokinetic therapy principles, to release the over-facilitated adductor or adductor hallucis in the middle of the foot, back to that blue one. And then I also did exercises to strengthen the before inhibited muscle of the abductor hallucis and the abductor digiti minimi. Boy, those are both mouthfuls. So that's how I did it. You can check back on some of our YouTube channel and look for anything on the pointy-toed world, on ankle eccentric exercises and short foot exercises, or give our office a call and come in and we'll do a consult and talk about any kind of health concerns you have about your feet. This is Dr. Stephen Gradwell. I hope you enjoyed the video. If you liked it, please like it and share it with people. If you have any concerns, please give our office a call. We'd be happy to help you in any way that we can.